Test 1 2 test.
Okay, we're going to begin in case we didn't hear that the first time. So my name is Peter Zanoni. I'm Corpus Christi City Manager, and this is our daily Nueces County City of Corpus Christi COVID-19 briefing. And today I'll be speaking first, followed by Chief Mike Markle. Our police chief's here. He's going to say a few comments about one of our officers that was impacted by COVID, and also just give us some perspective on how to stay safe and what the police department's doing. And then Annette Rodriguez, our Public Health Director, will speak. And then we do have Nueces County Judge Barbara Canales and Mayor Joe McComb, and they're going to speak also. Oh, Joe, Mayor's here to listen, he said today. Right, Mayor? And so that'll be our briefing for today. I did want to begin by acknowledging listeners that are listening to FM 90.3, that's KEDT, that's our NPR station here in Corpus Christi. And Don Dunlap, their president and general manager, sent me a nice letter over the weekend, just wanting to bring out or point to my attention that they do have listeners that listen to this every day. We see the media here in front of us, and KEDT gets a live feed from this, and so we weren't fully aware of that because they're not here in front of us. But they have anywhere between 45 to 60,000 listeners in their drive time. Beginning at 5, so they air these briefings live on their radio show. And their broadcast goes as far as Victoria, is what Mr. Dunlap was saying. So we wanted to acknowledge that and thank Mr. Dunlap for sending that nice letter to me. And we want to thank the listeners for listening on radio. Okay, so we're going to begin with the number of new cases. We have a graph here. We thought our 445 would be our highest number, but unfortunately today we have to report a new case number of 605 new positive COVID-19 cases for Nueces County. That is much higher than our 7-day average of 366, and it's higher than our prior highest day of 445. It's about 35% higher than that prior highest day we had of 445. I was speaking with Annette and Dr. Dante, our assistant director, and there's some thoughts that number could even be higher in the coming weeks, more than 605 new cases every day. So we're going to talk more about that in some of the material we covered today. We also spoke with Dr. Bird from Texas A&M University, and with today's 605, or really with the past 7 days data, he reminded us, and we know, we've heard him say it before, but the Nueces County is leading the state and per capita in the number of new COVID cases on a 7-day average. We're leading the state when it comes to metro counties per 100,000 population. So we're unfortunately the county that has the highest number of new cases every day per 1,000 population. We're also the we're number 2 in counties for the average daily fatalities per capita. Okay, number 2 in all of Texas for the number of fatalities. And then we're number 5 in daily hospitalizations per 100,000 population, right? So those statistics are not good for us here in Nueces County. We're going to talk later about what we're going to do to try to bring these back in line and stop that spread. So 605 is the new number for today. When we go to the next chart, we can see the number of active cases compared to recovered. So that orange slice is the recovered cases. But with over 2,000 active cases, that's 90% of all persons that have the COVID. The cases are currently active. A little bit of progress in the hospitals. There's 5 fewer persons recovering in the hospitals today compared to yesterday. Yesterday there was 331. Today there's 326 persons in the hospital. And then when it comes to ICU, persons that are in the hospital but are in ICU recovering, it's about a 15% decline since yesterday. So yesterday we had 96 people in ICU, and today we have 83 recovering in ICU. The number of deaths, there is 64 in total, and that includes 6 additional deaths that we're reporting just today alone, 6 additional. So that brings our death toll to 64. And today at City Council, Annette had a nice chart that showed where we were several months ago. So in April, we only had 3 deaths for the whole month of April. And then in May, we had 0 deaths in Nueces County. In June, we had 5 for the month. But through July already, we have 56 deaths, right? So a big increase in July, 56. And then this is our running 7-day average, and since the beginning of time kind of chart and graph. The blue bars indicate the number of new positives per day. And then the orange line is the 7-day running daily average. And you can barely notice it now, but there was a little bit of a spike back over here when we had the meat processing plant and some of our senior facilities. But you can really see this is the issue our last couple of weeks in July. And today's 605 number, you can see our trend line is back up again. Yesterday it began to downturn, but it's back up today. So the average, 7-day average is 366 new cases on a 7-day average. Okay, I'm going to turn it over to the chief in a moment, but on our Facebook followers, we get to see what people write, and some of the comments that have been made over the past week or so is that we shouldn't be advertising to have people come down here to Corpus Christi. And I want to clarify what we're doing as a city. So the city has a contractual relationship with the Convention and Visitors Bureau, which is run by a separate board, several appointees by the council. And we have a new director and executive director, CEO, who we recruited, Brett Oding. And he, through our advertising agency, informed all our locations where we have advertisement to remove it in June. And we thought it was removed in June, but last week, after staff saw some of the social media posts, the staff at CVB did some additional research, and what we found out is that it wasn't removed in June, like we had told them to do. And so over the past couple of days, staff has reached out to all television and billboard media companies to personally tell them, take down all our advertising that said come to Corpus Christi. That should have been done in June, but it wasn't. Through our ad agency, it was not done. So there currently are no paid tourism dollars used anywhere in the state of Texas to encourage people to come here. That has been now removed without any question. So I just want to point that out to the community that's been following this. It's an important issue. Okay, and then we know last night we lost one of our senior police officers, Officer Williams. And Chief's going to talk about that in a moment, but I did want to point out that last Friday we lost our first city employee, and it was Lieutenant Bobby Almaguer. And I want to take a moment just to mention him in remembrance of him. We're going to have John Hyland, the chief at the International Airport, our police chief up there, our public safety chief. He'll join us later this week, but let me just take a moment to talk about Lieutenant Bobby Almaguer. Lieutenant Almaguer died last Friday, 2 complications of COVID-19. He, again, was our first city employee to pass. And he worked for the Corpus Christi International Airport for 24 years in the public safety division. Within those 24 years, he was in public service. He became a master aircraft rescue fighter. He was an EMT. He was a master peace officer and an instructor as well. As a first responder and a key member of the airport team, he dedicated his professional life really to helping people and keeping things safe and secure at the airport. So our condolences to his family and his family at the airport. We know it's a tough time for him. And then additionally, last night, we lost a legend in Corpus Christi, Officer Williams, and I'm going to have Chief Markle give us a few words about him and then talk a little bit about public safety as well. And so before we have him come up, we're going to have Gabby translate into Spanish what I covered.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 605 casos confirmados por el coronavirus, haciendo un total de 7,032 casos. 326 personas continúan en el hospital, 83 de ellos están en la unidad de cuidados intensivos. 6,293 casos continúan activos. El día de hoy se reportan 6 fallecimientos adicionales, haciendo un total de 64. El condado de Nueces continúa teniendo el mayor número de casos diarios positivos per cápita en el estado y es el segundo en cuanto a fallecimientos, pero le seguimos dando información de cómo podremos cambiar esas cifras. Asimismo, la ciudad cuenta con un contrato con el Buró de Turismo. La administración había pedido a la compañía que cuenta con esa publicidad que retiraran esos anuncios publicitarios, pero esos anuncios no fueron retirados. La ciudad se va a encargar de que no se esté anunciando visitas de turismo hacia la ciudad de Corpus Christi. El viernes pasado, el oficial Bobby Almaguer, oficial del aeropuerto de la ciudad de Corpus Christi, perdió la vida debido a complicaciones del coronavirus. Y anoche también le anunciamos que el oficial Chuck Williams perdió la vida también debido a complicaciones por el coronavirus. A ambos oficiales y a sus familias le queremos dar nuestro más sentido pésame.
Good afternoon, and I want to thank Peter Zanoni, City Manager, for giving me a few moments to express my appreciation for the outpouring of condolences and love for Officer Chuck Williams. Chuck Williams has been a part of this fabric of this community for 35 years. He's not just a police officer, he's a basketball, football, swimming coach. He's a referee. He's somebody that I have yet to hear from somebody that did not know him. And that's the testament to your police department, to your officers investing individually into their community. Chuck was raised here. He knows the neighborhoods. He knows people personally. And he went to great lengths to make sure he served this public as he should as a public servant. So we are going to miss Chuck greatly. But I want to express further that Chuck is just one of many that we've lost in this community. We've lost many community members who have loved ones and friends who think exactly the same thing about those losses. And I want to express to you a message from the Williams family that they so believe that we need to take this virus serious that they have postponed any kind of service for Chuck. There will be no services until next year. There will be no services. They are so worried that they would bring folks together and potentially risk them to further harm with COVID, that they've chosen to postpone that. I commend them on those decisions. I commend them on taking this seriously, and I implore upon all of you to do the same. Now, as your police department, we have lots of challenges, right? We have to close beaches and roads, and those are all for good reason. Parks, and now we've also implemented some proactive teams to go out and check these sports bars and bars who, although I understand they want to move on with their business, we have to be responsible. And we're going to step up our game a little to try to help them, persuade them to be responsible. So I ask all of you to give this some time, to do your part. Stay inside when you can. Stay close to your family. No social gatherings. We had a little rally last week, probably should not have had. I see the same folks plan to have another one, and I'm asking them here publicly not to do that. This is a support your Back the Blue rally, I think I saw on Facebook they want to have. If you want to back the blue, don't have these kind of things. Don't put us in a position where we have to go and make personal contact with folks and expose our officers to COVID, and where you're bringing people together and exasperating the issue right now. Do your part. Let's do all of our parts and protect each other. Follow the core tenets of what's going on right now. We all know them by heart. Let's be respectful of each other. Wear masks. Wash your hands. Stay apart. And help us all. Help your police department. Help you. All right? Don't put us in a position where we have to be in the middle of crowds. So thank you. Again, City Manager, thank you for giving me a few minutes to speak, and God bless all of you. Thanks.
El oficial Chuck Williams dedicó más de 35 años de su vida a la ciudad de Corpus Christi como oficial. Él era una leyenda, mucha gente lo conocía, pero él era solo uno de muchas personas que han perdido la vida. La familia de Williams indicó que no habrán servicios fúnebres hasta el próximo año, ya que no quieren arriesgar la vida de más personas. Otros lugares han cerrado, como bares y las playas, para evitar más contagios. La gente debe ser responsable, haga de su parte, y le pedimos a la gente que no tenga más protestas o rallies y exponga a más personas.
Annette Rodriguez, Public Health Director. So my sincerest condolences do go out to the 2 fallen officers for the city, as well as the 6 deaths that we just experienced and heard about today, and their families and their friends. We did have a drive-through this morning at the Health Department, and we will have another one tomorrow as well as Thursday. Nueces County is in a dynamic and quite serious situation with continued increase of cases and now positive cases in excess of 600 today, when just a few days ago we had 445 as our all-time high. Frankly, it's so distressing to public health, health professionals, and our leaders because we know that we can control these numbers. I'm going to try to make it as simple as possible. You have family members. These family members are the ones that you are free to be around. 2 adults in a household, fairly simple. You know where I've been, you know where they've been. Probably work and then back home. Maybe to curbside to pick up groceries. Simple. As your family gets bigger, you may have small children. Still fairly simple. These people you can be around, parents and their children. Because these children, you know exactly where they go because you control that. As your children get older, it becomes a little harder because now they're teenagers. Now they're able to drive and now they're able to go to places on their own. So teenagers may be here and there, and sometimes you don't know where they're at. And so it's a good idea to talk to your children and to find out, where are you, where have you been, who have you been with, so you can understand if they are practicing risky behavior that could put you at risk. Don't live in fear of COVID-19. Just talk to your children, find out where they've been. Ask them who they're hanging around with and explain to them about behaviors that can negatively affect you. Talk to them about public health basics. Wash your hands. As the minute you walk into this house, the first thing you're going to do is wash your hands. And not only are you going to wash them, but you're going to use warm water. You're going to take at least 20 seconds and you're going to wash them thoroughly. Don't touch your eyes, nose, and mouth with your dirty hands. This is a really good time to stop biting your nails. You can infect yourself with the virus. Also, clean and disinfect frequently touched objects. I heard Judge Maderi say today, act like you have purple paint on your hands and think about all the places that you have touched. Now go and clean them. I love that. We all have free will. We get to make choices every day. Here are 2 choices that we have. Number 1 is I do not want to get COVID-19, therefore I'm choosing to stay at home. I'm not going to go out. I'm going to wait till there's a vaccine or an antiviral available before I choose to leave my home. Number 2, I don't care if I get COVID-19 or not. I want to go out to parties and large gatherings and do whatever I want to do. I get it. Number 1 is extreme to the left, and number 2 is an extreme to the right. Maybe neither of these are good for you. Find something in between that works best for you. Think carefully about what you decide. How important is this to me, and is this party, this event, this big celebration worth the consequences? I heard Tom Hanks say recently, if there was a column of the least you could do to help fight off this horrific virus, I think wearing a mask and social distancing would have to be in that column. Surely we can all find it in us to do the very least for each other. Stay protected, protect your families, stay social distance, and as always, stay informed. Thank you.
El condado de Nueces se encuentra en una situación bastante grave con aumentos continuos de casos y ahora casos positivos de más de 600, cuando hace solo unos días 445 era nuestro máximo histórico. La situación es muy angustiante, pero usted tiene el control de esas cifras. Usted sabe dónde se encuentra su familia, especialmente si son adultos o niños pequeños, pero cuando se trata de adolescentes a quienes les gusta salir, es más difícil controlar sus salidas y saber con quiénes han estado en contacto. Es importante que platique con sus hijos, explíqueles que el no tomar medidas de precaución puede afectar negativamente a otras personas. Inste en ellos conceptos básicos de salud. Lávese las manos cada vez que entre a su casa. Use agua tibia y tome al menos 20 segundos para lavarse completamente las manos. No se toque los ojos, la nariz o la boca con las manos sucias. Puede infectarse con el virus si se llega a morder las uñas. Limpia y desinfecte objetos frecuentemente tocados. Todos los días tomamos decisiones y se resume en 2. La primera, usted puede decidir que no quiere obtener el virus, por lo tanto, elija quedarse en su casa hasta que se obtenga una vacuna o medicamentos antivirales para tratar ese virus. La segunda, usted puede decir que no le importa si se contagia, prefiere salir a fiestas o reuniones, hacer lo que quiera hacer. Estas 2 opciones son extremas, pero piense en las consecuencias y si valen la pena. Todos podemos hacer un esfuerzo para ayudar a salvar otra vida y ayudar a reducir la propagación del virus.
Good afternoon, everyone. Barbara Canales, Nueces County Judge. Well, for me, today is another bad day. It's a frustrating day because earlier this afternoon, I guess closer to about the 1 o'clock hour, I received word that we had about 500 positive cases. And quite frankly, I almost fell over in my chair. But when I was on my way over to this press briefing and realized that number had grown to 600, with 6 deaths today, it's really hard to let that sink in and not have it affect you. But what keeps me hopeful is this idea that there are measures to turn this completely around. What keeps me hopeful is the idea that the measures that we took and put into place earlier in this month, the requirement for masks, like I have on today, or any other facial covering, the restrictions on the beach access over the 4th of July weekend, and other methods that we are exploring right now to do everything we can to keep those hospitalizations down, to keep the fatality rate down. And in the meantime, we are dealing with the consequences of all the earlier decisions that we've made. So even though I'm hopeful that the measures that we have taken and you have taken will show results in the next 2 to 3 weeks, unfortunately, we still have the consequences of the transmission of the virus. Some of the actions we have taken from the state, county level are really focused on lowering these infections, hospitalizations, and deaths. And others are really designed to make certain that we have the right resources to respond to what's happening in our community. As of yesterday, Governor Abbott has secured federal resources from the Department of Defense to assist the state of Texas with our response. Some of those federal resources will likely come from military assets here in Texas, from the United States Army and the Army Reserve, the Marine Corps and Marine Corps Reserve, the Navy Reserve, and the U.S. Air Force and its Air Force Reserve. We are a proud state. We are home to many, many military bases, including 3 here in our county. And yet, what does it say to us that the great Lone Star State is turning to the federal government for assistance at this time. You know, for me, it's alarming, and it should be for you as well, because as states go in our union, Texas functions in many ways like a small country. We have tremendous resources. We have state forces of our own in Texas, the military department, the Texas Army National Guard, the Texas Air National Guard, the Texas State Guard. And quite frankly, I learned something in this pandemic, that we in Texas are affected by more natural disasters than any other state in the union. So you know what that makes us? Ready. We're ready, we're prepared, we're organized, we're completely resilient. And yet, yesterday, Texas asked for the federal government's response. So if you don't think this is real, if you don't believe that it's happening the way we are sharing with you every 5 o'clock press briefing, that alone should shock you. It should take you back. It should make you share with anybody who tells you differently. Because the United States government has come to Texas because we are in such great need. And in fact, yesterday, as I told you, we received a DMAT team, a disaster medical assistance team at Christi Hospital. Now, don't get me wrong. Texas, we are a prideful state, and we rely on our own values of self-sufficiency, and we invest deeply in our emergency capacity, and we have some amazing capabilities. I just want to point out today, and I have made it my theme today, that if we're turning to our federal partners for help, this is not something we do lightly, and we don't necessarily ask for help because we can't figure out the answers on our own. We ask for help because we have reached our limit. We have reached our limit of the abilities that we have, and now we seek the Department of Defense to help us get the resources exactly where they're needed the most. And I want to share with you that they're needed here in Nueces County. And these include people that, and equipment that the governor has identified yesterday. And I just want you to familiarize yourself with these acronyms. They are United States Army Urban Augmentation Medical Task Forces, and they're going to be basically operating out of San Antonio and Houston. And today I spoke with Judge Tijerina in Webb County, that's Laredo, and they are getting a hotel converted into an entire hospital to alleviate the strain on the healthcare system there with support from the DOD. And there's many other task forces that I wrote down here, but suffice it to know that response teams are in Texas, they're on their way, and they're going to be targeting South Texas. And I don't want you to be surprised if we get some of these assets here because they're needed. These teams, of course, are all professionals, and they're deployed to support medical needs in hospitals primarily throughout the state. So I have had, I don't know if we have some of the graphics here, but in Nueces County, we are seeing some of the worst days. And I believe that although we've taken the steps that will reduce infection, hospitalizations, and deaths, we've said it many times, hope is not a strategy. And things can get a lot worse before they get better. And so all of the great advice that you've heard today from Chief Merkel, Director Rodriguez, and City Manager Zanoni indicate that we are actively engaged with our partners as part of these ongoing resources. And as bad as our problems are here, it seems some way that there are always worse elsewhere, and help will always go where it's needed the greatest. But when you're number one in Texas, it's hard to figure out where else it's worse. So I'm going to continue to work with our federal partners. Congressman Cloud advised me he will be here with us in our city and with our hospital providers on Thursday. And we're going to work together to build capacity, to to raise the bar on that graph. And as we work to raise that bar, we need more than ever, everybody out there, to do as the Chief and Director Rodriguez said, help us flatten the curve by using the very simple methods of mask wearing and washing hands. I need people to act as if their lives depended upon it, because they do. And all you can do is all I can do too. So I ask you what I ask of myself. Stay home as much as you can. Practice all of these social distancing. Please do as the Chief said. If you want to help, if you want to support, limit your activity so that they can limit theirs. Please wear a facial covering. And I'd like to address a real concern that we have at the county, and I've expressed it to my city partners, and that is all of the out-of-town visitors that are coming for day trips, short vacations, and just general summer fun. It's got to stop. It has to. Because at 600 cases a day, it's untenable. We cannot, those 600 cases, they'll turn into hospitalizations, a portion of them. They'll turn into ICU, and it pains me to say this, but they're also going to turn into fatalities, because that's what the statistics and the data show. So we have to suppress these gatherings. We have to, for our own sake. So please do everything you can. Tell your family that lives out of state, your best friends, your reunions, all of the wonderful things. Not today, and maybe not tomorrow either. Come when the coast is clear. Please. And together we can flatten that curve. And I think they're looking here for a particular graph, but it's not going to work today, but we'll bring it to you tomorrow. But what it shows is how over time we've moved from the bottom to the top. I know we keep saying it, but I want you to see it animated in real time, and we're going to bring you those graphs tomorrow. So as a result, any leader is required to act with courage. We can ask, but we must do. And so I'm going to ask you, and then I'm going to also do. So I have reached out today to my colleague and my, quite frankly, co-partner in this pandemic, Mayor Joe McComb. I've reached out to my other partners along the coast, Judge Madrid, Clayburgh County, Port Aransas Mayor, Mayor Bouillon, and together we have asked for another consultation with the General Land Office, because we do not think it's unreasonable at this point to begin the discussions of once again having to restrict access to our beaches. Because last week was a nightmare, and it cannot go on anymore, because we are at capacity. And I want to leave you with a grim thought. Yesterday, you heard Manager Zanoni say our ICU deaths had gone down by 4. How many deaths did we have yesterday? 4. You know why those ICU beds are empty? Because people died. Today, our ICU beds went down by 6. Well, guess what? We lost 6 people. This is simple math. We have to make a change. And you know what? That is a strategy. So that's a way to combine hope. You want things to get better? Let's change the game. And that's what we're going to do, God willing, in the next few weeks. We're going to change the outcome by changing our actions. Some of them will be voluntary, and some of them are going to come from leadership. And that's the true definition of the word. is to not be afraid to be able to act on others' behalf. So I look forward to better days ahead, but they're not coming this week, my friends. And I, like Director Rodriguez, believe that 600 is a number that's horrific. But my concern is, based on what I know and how many people we've just tested and how many tests we're waiting on, that number has the possibility of yet be broken again. So with that, I leave you with, I guess, an impending decision that we'll be making. And I do want you to know, when we make these decisions, there are always opportunities for you to play a part so that we can change how restrictive we have to be. So with any luck, once we get guidance from the General Land Office and they believe that this public emergency is a reasonable request to restrict access like we did on July 4th, then there'll be a day when we call them and say, we're doing better again. Grateful to all of you that are doing it right. Truly, I am. And I want to thank you for all the letters of support. And I even want to thank all of you who completely disagree with me. You know why? Because you give me the courage to do what's right. Because as long as you're writing to me and telling me how everything we're doing is not in the best interest of public health, when I know that the health experts here in our community are telling us the opposite, you give me the strength to get up here every single day and try to do a little bit of preaching, a little bit of coaching, a little bit of cheerleading, and a whole lot of refereeing. And together, it's just got to make a difference. So thanks to everybody for expressing their opinions, and I'm sure there'll be opportunities for us to answer your questions. But again, these are preliminary discussions. We hope to have a final decision with all the stakeholders and electeds by tomorrow. Thank you.
En resumen, es muy difícil escuchar el número de cifras del día de hoy. Es muy frustrante, pero existen varias medidas que pueden cambiar la situación. No solamente usando los cubrebocas o cerrando las playas, pero vamos a seguir explorando otras ideas para reducir la transmisión del virus. El día de ayer el gobernador aseguró contar con recursos federales que nos van a ayudar, esencialmente con personal calificado. El contar con esta asistencia federal es alarmante, ya que aunque contamos con recursos estatales, una vez que el gobierno federal interviene, no son buenas noticias. Esperamos que tome toda la situación actual con seriedad, ya que pedir ayuda federal no es una decisión fácil, ya que llegamos al límite y el Departamento de Defensa tendrá que asistir. Varios grupos militares federales estarán desplegados en todo el estado. El blanco es el área sur de Texas. Todas las recomendaciones que ha escuchado por parte del jefe de policía y la directora de salud, le pedimos que las siga y evitar así el aumento de casos y hospitalizaciones. Más que nunca solicitamos de usted y de su participación. Quiero que actúe como si su vida dependiera de eso, porque la realidad es que así es. Quédese en casa, practique el distanciamiento social, lave sus manos y use el cubrebocas. Otra preocupación que tenemos son los visitantes de otras ciudades. Las visitas deben de parar, ya que muchos de esos 600 casos van a terminar en hospitalizaciones. Dígale a sus familias y amigos que hoy no hay reunión hasta que la emergencia haya pasado. El día de hoy también me dirigí a mi colega en esta pandemia, al alcalde, al juez Madrid y al alcalde de Port Aransas, para comenzar a discutir la restricción a las playas nuevamente, ya que este fin de semana estuvieron abarrotadas. Los fallecimientos continúan y no queremos que eso suceda, así que haremos lo posible por cambiar los resultados tomando las medidas necesarias. Espero que tengamos mejores días, pero yo creo que esta semana no va a ocurrir. Queda en usted que estas restricciones continúen ocurriendo.
I just wanted to add one thing to the judge's comment. So the mayor and I, the mayor generally works in parallel or in unison with the judge. And so the judge was talking about the beaches at the Gulf, our Gulf beaches, but we're going to parallel that with the Bay beaches. So beaches like North Beach and McGee Beach would also be closed, pending the decision on the Gulf beaches. And then along with that, our 8 regional parks, we'd also close those, and that decision will be made tomorrow when we make the decision on the Gulf beaches. So regional parks like Bill Witt, Water's Edge, those big parks that have a lot of room for people to congregate would be closed too, along with the two beaches that are popular up here at the bay, and then the Gulf beaches. Okay, so that concludes today's press briefing. Myself, Judge Canales, and others are here, should you have any questions from the media. Okay, Seth has a question. Okay.
This is actually for Judge Canales.
For Judge Canales, okay.
Yes, sir.
One second. Today we got confirmation from Sheriff Cooper that 30 employees have been reassigned to the jail. I just wondered if we could get some clarification on exactly what's going on there.
Sure. So the clarification is that I think he is like so many other establishments that have a workforce that have been compromised with COVID-19. The jail is one of those places. And so he has the hard task of, when he's already has lots of vacancies, to try and deal with a reduction in workforce because members of his staff have to quarantine, in addition to already kind of being low, if you will, on vacancies. And so they have been testing, I guess we started last week, and like you might expect, any workforce, there's going to be positives, in there. So to be honest with you, I've not spoken with the sheriff today, but it does not surprise me that he's having to bring in additional workforce there, or to readjust.
You having not spoken to him, you may not know. Are we talking about the jail or the annex? Do we know?
So it's my understanding that, of course, over a week ago, we had positives in the annex. We knew that. And I'm not certain where his workforce, a lot of these guys will go both at the jail and at the annex, So I'm not certain. I don't get the private information as to who's tested positive. But if you see that reshuffling, it's most likely because, there's cross-collateralization as to their work environment. So I wouldn't be surprised if he's, making those adjustments so that there's not anymore.
Makes sense. And again, we having not spoken to him, 30 employees is kind of vague. Do we know if that's 30 deputies? Have you heard anything along those lines?
No, I haven't. I tell you what, I would like to get that information for you, and he was definitely on my radar today to call because we have court tomorrow, and I always give a COVID update as to where we are, on county employees that have tested positive. I will say that I think it's a very good thing, and I'm glad that we all encouraged. I'm going to have to learn how to talk and not have this come down. I really believe that the proactive approach is the best approach. So I'm very grateful to, health department and for the support, because in emergency management we have always advocated, look, test your folks. You've got to know, because that's the only way then you can limit, this transfer of the virus.
And the last thing is, we don't know, again, if it's all deputies, if it's 20 deputies, it still seems like a pretty big chunk. Is there any concern about patrols, and is there any concern that a deputy may not have that skill set that it takes to handle a jail population?
So obviously it would be wonderful if the sheriff were, it's really his department with his deputies, but I'll tell you what I know just from being county judge and understanding, the budget, and that is that we don't run a heavy patrol. We're not like CCPD. We run heavy jail corrections and heavy staff. But, we also have people that run, accounting. We've got people in mental health assessment, risk assessors. There's so many different components to a jail. It's not necessarily all correctional officers. So I think he would have to be really the person to identify that. But I'll tell you what, in the interest of transparency, you've asked the good question. Let me get the good answer and have him identify for us where they are and how he's dealing with that problem. My goal is to test him. Yeah, thanks. Sure.
After your statement yesterday where you asked people not to come down to voices, we actually had somebody reach out to us who tried to cancel their reservation in Port A.
Mhm.
And was told that short of beaches being closed and short-term rentals being prohibited, that the person couldn't actually cancel
Cancel.
the reservation and receive a refund.
Right, so that's interesting. So let me just say this. Let's talk about July 4th, because anything else is not really written yet. Let's talk about what we did on July 4th. On July 4th, we had curfews at night. Made sense, right? Sunset to sunrise. And then we said we're going to close vehicular access. But if you live on the beach, right, that's your backyard. So there is not a taking, right? We're not taking away that opportunity or that right if you're in a condo to walk to the beach. What I think is really very important is how many day trippers, so to speak, vacationers we have, or people who come in, for an overnight that are not necessarily in a home or in a short-term rental. Most contracts do have a force majeure clause, right? That's the clause in law that gives you the ability to be excused from your contract if something unforeseen happens, like a public emergency. And I really think that we're all struggling with this idea of shouldn't I be able to, contract if I'm just going to stay in the home and do things right? And the answer is, of course, you have that right to do that. What we're really saying is that we want to limit access in a way that changes our numbers from 25,000 in a certain interval to that 4,000. Remember that great number, that great spread that we showed over July 4th weekend? That's what we need. And again, it's heartbreaking for the mayor and for myself to tell people, don't come. And of course, I can't interfere with contract, so that's an unfortunate situation. But I do believe that I would not want to put my family in a situation where we're beyond hotspot. I mean, you're like in the coals of a hot fire. A hotspot is, wow, it's hot, let me back up. This is, I'm inside the fire. Why would you want to come inside the fire? I don't understand this. And I think that for me to be dramatic about how I approach it is not hyperbole. It's honesty. And I think that we need to do everything we can, because I want to save what's left of our summer. But we're not going to have a shot at it. And also, I'm very sensitive to schools. Part of the reasoning and the rationale behind what we're thinking is because we are trying to create an opportunity to have a safe environment in the fall for schools. How can we possibly do that with the numbers that we're producing? It is impossible, and it's just not feasible to think otherwise. So I really feel for that woman and or that particular individual, and all I can say is let's see what the rest of the week brings, and maybe they will have the ability to reschedule. It's because it's a private contract, I'm not able to interfere. Same thing with a hurricane. If we made a reservation and a hurricane approached, would you be able to get your money back? The answer, that depends upon the contract, right? And the individuals that are involved. Go ahead.
Yeah, I'll repeat the question. No, whoever has the next question, I'm going to repeat it so people can hear it, because they can't. Yeah, that's okay. They can't hear. That's not working. That microphone. The microphone's not working. So yeah, I'll repeat the question. Yeah, what is the question? Yeah. Okay, so the question was, do we have more positive cases in our police department and within the city? The answer is yes. There's numerous police officers, firefighters, and civilian employees who have COVID. I don't have the number in front of me today, but it was late last week, there were about 20 police officers, 20 firefighters with COVID. And I don't have the number of civilian employees, but there are. Everybody's being impacted across the community as our city employees. Courtney?
With 10 days since the 4th, do we believe that our increase in numbers are a direct result of the impact on the 4th?
Yeah, I think Annette could probably answer that, but the question is, it's been about 10 days since the 4th. We know that anytime there's a major event or something that'll trigger a high spread of COVID, it takes some time, right, for the new cases to show up. And we think a lot of this is from the 4th of July. And Annette, I don't know if you want to add anything to that.
It's the obvious, the incubation period, the 2 to 14 days. So from the 4th, you add those days in, that's what we would be seeing. Plus, I think there's a lot more testing now. I think there's more resources out there. There's more testing. Military testing team is doing quite a number as well. And so we're seeing increased numbers. So there is more transmission. We all know that. Otherwise, we wouldn't have 600 cases. We talked about our phone banks. People are sick. They're calling. They're sick, and they're testing positive. So the more transmission, like Dr. Bird has explained, the more transmission is out, it's just exponential. And that's what's happening at this point as well.
Actually, I've got a question for
Judge.
And I've got some interesting news, too, to share. Go ahead with your question. Okay, well, the interesting news to share is that we are going to start a really awesome ad campaign. I believe it's going to, I just got it. Mayor knows all about it. It's really in conjunction with the business community here in Corpus Christi. It started as an idea from the CCRADC to really get a social media campaign working. In other words, hey, we like coming up here and talking to you, but how many people are we really reaching this way versus how many people can we really reach through all the different mediums? And the governor's office gave us all these great PSAs, but we've developed our own too. And thanks to Bill Pettis and Pettis Advertising and Commissioner Al Jones, who spearheaded it, and all of the communications folks, that's going to get launched tomorrow. We need this to spread like fire, like wildfire, because we think that if you're watching this, there's a really strong chance that you're doing the right thing. We need to get our message out beyond NPR, beyond the news, into the hands of the people that really need to hear it the most. And so I'm excited, and again, I use this word, hopeful, that this is also another proactive measure to do a very robust, and by the way, I understand it's going to be everything. It's going to be TV, ads, it's going to be radio, it's going to be print, so maybe some billboards, and a whole lot of social media. I think this is very, very good news, and I know they were working on it, but they just text me that it will launch tomorrow. I'm sorry, Courtney, but that was, I think, important for you guys to hear. We'll be looking for it. So jury trials are actually moved again to the month of September per the Texas Supreme Court. So we buy another 30 days in August to continue to make our preparations. Our courtrooms will be ready. We were going to be ready for August 3rd, and we're going to have a ton of safety precautions. But I think the extra 30 days is warranted given our situation here. So don't look for jury trials until September at this point. And we always take our direction from the Texas Supreme Court and the Office of Court Administration. Thank you. And the question was, are our courts ready or jury trials ready? So just want to make sure. Thank you.
Okay, any other questions? Okay, no other questions. That last question that Courtney asked was about court trials, right? they're going to resume in November, and the judge answered the question. Okay, that concludes our press briefing for today. Today's Tuesday, so we'll be back Wednesday. Tomorrow, I think Judge and the mayor should have their work completed by then in terms of access to beaches, and we'll parallel on that with access to city parks, regional parks, and the bay beaches. So that'll be tomorrow. Okay. Well, the mayor and the judge have the emergency power authorization, but the item will be placed on a court agenda and a city council agenda next week if they move forward tomorrow. The voting on the closures, the full court will. Yeah.
Do it as quickly as our pens can write it, but I think that I'm just of the mind that I like process. People don't, people want to do it like that, but it works better in government when you include everybody. Because, for example, I learned today that Cameron County, they extended theirs, and we didn't even know it until July 27th. So this explains to me why we've had this push up here. If Cameron's got their beaches closed,
Yeah.
people push up. So I think that this is why I like talking to everybody. So I'm looking
Yeah.
to create a Gold Coast Beach Alliance. I'm tired of this business of, we need to all go together. So we've been working on this all day, and that's why I don't want to tell you it's going to happen tomorrow, but that would be my goal.
Okay, we'll see you all tomorrow. Thank you.